Hi students, this is Veronica Hodges, your coding instructor. Right now I want to discuss E&M code selection based on what we are learning in this course. Now, I do want to let you know there is a significant difference between learning how to select the code for this course and E&M auditing. If we have additional time during this semester or this quarter to discuss the ins and outs of E&M auditing, I will do so. I've been an E&M auditor for quite some time, and that is a very good skill set to have. But for right now, we're going to focus on how to determine a code for the class, for your assignments, and or for your test. So, what I've done was I've gathered a couple of steps that I want you to follow when you have questions, assignment questions, or test questions about determining a level of service as it pertains to E&M codes. So step one, you want to always determine your place of service. When you read your note, read your test question or your assignment question or your homework, and there's a level of service rendered, you need to figure out the place of service before you do anything else. After you complete or figure out the place of service, you want to always figure out or find in your CPT manual the actual E&M category. For example, if the patient is seen in the hospital, the patient is seen in a doctor's office, then you would look for the category for office and or other outpatient service. And then you want to determine or review the required key components of the code in that selected category. For example, take a look at 99213 on page 12 in your CPT manual. As you can see, this particular code says that 2 out of 3 key components are required for this particular code. Remember, key components consist of history, exam, and medical decision making. So 2 out of 3 of these components are required to be in the documentation, to be in your assignment questions, to be in your test questions, or in your homework questions in order to select the appropriate code. Step 4. Review the documentation and select the appropriate code based on the E&M requirements. Special note: there are clinical examples of E&M codes in Appendix C of your CPT manual. I know that this material is new, but the clinical examples will help you familiarize yourself with the level of service based on signs, symptoms, or definitive diagnoses and the management of those problems. And also, you may not understand, okay, well, how do I determine if a medical decision making is high or low, being that we're not getting into all of the auditing pieces of or components of E&M. You have the clinical examples in your appendix that will help you kind of figure out the difference between 99213, 99211, and 99214 based on the clinical examples. So please refer to the Appendix C if you get confused or you are trying to figure out the difference between one or two codes. Let's practice. Let's say a patient was admitted to the hospital for a myocardial infarction, which is a heart attack. It was determined that the patient had a comprehensive history, comprehensive examination, and high-level decision making. So for step 1, you have to figure out the place of service. And of course, it's the hospital and the patient's in the inpatient setting. So the E&M category, if you look at step 2, will be initial hospital care. So in initial hospital care, you want to review the codes in that category, and as you can see, the required components for each code in the initial hospital care category says that all 3 key components are required in order to select the level of code here. So, as you can see, this patient has a comprehensive history, a comprehensive examination, and a high-level decision making. So, of course, the appropriate code to select will be 99223. So, let's practice. Let's say a patient, of course, went for an office visit, and the patient is an established patient with hypertension and diabetes and is on a drug regimen. It was determined that the patient had a detailed examination and a moderate medical decision making. Now, being that this patient is established, of course the established patients in an office visit, in this particular category, the key components state in your CPT manual that 2 out of 3 key components are required. Now, as you can see, this question gives us the examination and the medical decision making. It does not give us a history, does not at all. So we have 2 components here. You will need to look at a code to see which code has a detailed examination listed as a requirement and a moderate medical decision making listed as a requirement. Once you review that information, you will find that the code for this particular example is 99214. Sorry guys. 99214. But I want to go back here. Remember, established patient visit, established. This is an office visit in the practice. This patient had a detailed examination and a moderate medical decision making. Here again, your answer is 99214. I want you to familiarize yourself with the steps that we discussed. I want you to also familiarize yourself with how to review the key components and the required components for whatever code you are selecting. Now, there are other codes in the E&M section that does not require key components. It requires a certain amount of time, like your critical care codes. Just read those guidelines and determine the amount of time before you select the code. If you have any questions, feel free to contact me. Thanks.